Okay, got it. Malama la maria ho eki pe he ke tonga mo rulang kotoa mo me mai ki he programa ko ye ai TWN pe ko le teo tonga World News e he fin. Ma fe api te e tai tale rea ki mo tolu. E fe whaka fo o whaeni ai au mau whakahoko programa atu pe mo Dr. Ray pe mi tonga eki pe foki ki a live on Twitter mi Salt Lake City, Utah. Pe foki a Emeline mo Brenda Kongaika pe mi Seattle, Washington. Ki mo pe pata hoko atu e whakahoko hatau ki lotu pata to kamata. Malo.
Let us pray. Our dear Heavenly Father, we thank Thee for this beautiful night that we get together as TWN affiliates, so we can be able to help our Tongan and our people here in America and around the world. We thank Thee for this opportunity and for the time that we have to share tonight. We ask Thee to bless Dr. Ray with his talent and skill, that he may be able to share it with us in a manner that is pleasing to see and to help our people. We thank Thee for Emmeline and Brenda and for myself for the health that we have. Thank Thee for all the things that You have given us in our lives. We appreciate and we love to serve fellow men in a better way and in a good way, that we may grow towards Thee in Thy ways. We thank Thee, Father in heaven, for all the things that You have done for us in the past, in the present, and in the future. We ask Thee to help us, that we may share our ideas and that people will understand and be benefit from. This prayer, we humbly ask Thee all these blessings in the name of Thy Son, Jesus Christ. Amen.
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 Oni.
Filho,
Malo pe malo la Maria tonga ko tope pe fakiki motor ko tope mo me mai gi ta program FFNE. Welcome back, Dr. Ray. It's Health Talk with Dr. Ray. And then I'm just going to circle it back to him to give us the outline of what we are going to talk about tonight, Dr. Ray. And I know it's the weather, it's hot out there in Tonga, and we don't want to keep you too long on that one, Dr. Ray. So
here it's like we are in sauna.
the sauna.
Here. Today I will talk about the IV fluid solution, which is the intravenous fluid solution when we go to the hospital and the doctor put it to us which one. But before I start talk about the intravenous fluid solution, I would like to talk about common thing, and it's common mistake. That's what make people in a cold weather get sick. They get common cold or flu. Okay. What we have here in our neck, we have the thyroid gland, we have the parathyroid gland, we have the saliva gland. Okay. So we have three of our endocrine system. Our endocrine system, that's the motherboard in our body. So if anything wrong, if any of one of our gland, the motherboard in our body will be hallucinated. Okay. Especially when the people get older, if they don't practice the thymus gland here, the thymus gland will be turned to fatty cells. So now the T cells, it will come from the thyroid. Okay. So when you get scarf and you cover here around your throat here, your neck, that will make you warm here. But once the scars getting down and air go inside, you will get sick because of the homeostasis again. You remember when I said when your kids take the cover, don't cover them, let the homeostasis work. So when you cover here, you make the very important gland warm. And then when the scarf go down, little bit of air go inside. Now you get cold and flu and sore throat, and you get tonsillitis too as well. The tonsils here. So you cover tonsils, saliva gland, thyroid, parathyroid. So that will make you sick. If you want to put the scarf, put it in a way it will never drop down. And when you go to the room, don't take it straight away out. Make the room feel your body and then take the scarf. Okay. But if you go to the room and take off the scarf, and because here is still warm, you know, that will make you in winter get cold after cold, chilly, sneeze, coughing. I would rather to not wear a scarf. But if I have to, I will put it in a way it will never drop down. So this will be warm. And when I go to my home from outside, I will keep it for like 10 minutes, 20 minutes. Then I will take it off.
Oh, wow.
You know, it looks like someone take a hot shower and go outside in very cold area. Definitely he will get cold and flu. Yes?
Yes.
That's what we do to ourselves when we cover here. The tonsils, and then we have tonsils, inflammation, tonsillitis. We have saliva issue. We have the thyroid. We have the So we cover a lot of this area there. Like we thought it will make us safe from cold and flu. But in fact, let our gland work. Let our immune system work.
You know,
Any
last
question
night,
about this?
last night during the show, I came in, I was cold, I was freezing cold, and I had the thickest scarf wrap around me in the room. It's got warm room temperature, but I was cold. And so this morning I couldn't get up. I was out all day until tonight. My husband told me, get up, just make sure you get up and maybe take a hot shower. That's what I did. I told Emeline, I will hop in the shower, and then if I feel okay afterwards,
But
I'll
any
come in.
fever?
No fever. No fever.
No fever.
No fever.
Any
But it,
headache?
huh?
Any headache?
Havoc?
Headache.
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 Ulo mamang.
Ulo mama,
Mamay,
no.
mamay.
My
Mamang
body,
ulo, sorry.
not my head, but my body. My body was just
Your
like,
body ache.
yeah,
And
not
how's the
ache,
taste of the
fatigue.
food? How is the taste of the food? You still taste the food or the
No,
taste is
I
gone?
haven't eaten anything. I had a big mango
Okay.
that he gave me, and he went and got me some cantaloupe. But you
Mhm.
know, he brought strawberries, cantaloupe, and then whatever.
I tell you, it
Dr.
will help
Ray,
you a lot. Yeah.
you know, as you speak, I have a scarf on, and I do this all the time when this time of the year here in Salt Lake City.
Yeah,
I
it's
have to put it.
supposed to.
I have to put it on because if not, I'll be very sick, especially with my neck, because I will get cold. And
Oh gosh, don't say that. It's in the genes.
I think so. But Ray, yeah, I'm glad that you say this tonight because I have this stuff all the time, especially when this winter is coming on. I do it because I otherwise I'll get sick. But
Oh,
after the snow comes on, if I stay like this, then it's fine with me. But at the beginning, when it's this month before the snow comes on, I have to put on my the thing on my neck because it saves my neck. Otherwise, I'll just get cold. I will have a running nose and all those things that you were just saying.
Look,
yeah.
I don't mind if you have the scarf, but keep the scarf around your neck. And when you go your home, don't take it straight away. Leave it for like 10, 15 minutes around your neck. So your neck here, it will get the home temperature. If you come
Yeah.
from outside and
Yeah.
take it straight away off, that's wrong. That's what
Yeah,
make you sick.
this is light cotton.
Mm.
And the one last night was a double, a double. It has a double warm wool inside, and then the sky. But I was telling him, we had a shampooer came and shampoo our stairway in a couple rooms upstairs. And when he finished, my husband turned the heat full blast, last night. So I think that's probably what happened. Maybe the cold air and the hot heater. So, but I'll talk to you about it later.
Yeah.
Yeah.
Okay. We'll talk about the fluid in our body and why I told you the mango and strawberries, it will help you for your cold because the amount of the salt. So we will go
Okay.
now and get the pen and paper ready because
Okay.
we will have some good information today.
Oh, great.
So the PowerPoint is ready. I numbered the PowerPoint
Yes.
slides. So when I tell you 4, you know which one make the life easy.
Okay, this is, you see it, Dr. Ray? It's on the screen now.
Yeah, IV fluid solution,
Yeah, I see. So
hypertonic, isotonic.
yes.
Yeah.
Yeah. So in our body, the fluid comes to 3 things: hypertonic or hypotonic or isotonic or isotonic. Okay. What the difference between the 3 and what is this mean to our body? And when we get sick and go to the hospital, we have different type of fluid and we are not sure if this isotonic or hypertonic or hypertonic. When we go to page number 2.
Okay.
You got it? Because I can't see.
Yeah, I got it, Dr. Ray. I think you just need to
So-
move your screen there, but it's on the screen.
Okay.
Do you have the tonic, the tone, and the ISO the same? Yes, we have it
So
on the screen.
this type of terminology we need to understand before we jump on. So tonic, that's we have the terminology about the concentration and sometimes like concentration and the pressure. And this we present by percentage per mil, okay? And similar unit. Like when I talk about tonic anything, tonic, this terminology, it's mean the like the similar unit. When I talk about ISO, that's mean same, okay? Hypo, it's mean under or less than. When we have hyper, it's mean we are over or more than. Any question in this terminology?
No.
Pretty straightforward.
Okay. So we jump
Mike,
to
did
the
you have a
basic.
question?
Who have questions?
Lynette.
Okay. Can we go to page 3 now? Because now we will start a little bit complicated. So
Okay,
you are
we
in
have
page
3.
3?
Yes,
Okay.
yes.
So when I ask here, how many fluid in our body? People, they will talk about blood. Yes?
Yes.
Yeah.
Okay. But here we have saliva. So the saliva is fluid. We have urine. It's a fluid. And we have the cerebrospinal fluid. That's fluid. We have the serum plasma. And we have the seminal plasma. So the semen plasma, that's for man, and seminal for woman, okay? But that's, I put like the 5 top liquid or fluid in our body. But in fact, we have 26 different type of fluid in our body, okay? So for men, we have 60 to 67% of the man weight, it's fluid. For women, we have between 52 to 55% of the woman weight, it's a fluid. So for example, if the man weight is 100 kilogram, so that's mean we have 60 to 67 kilogram, it's fluid. You got it?
Got it.
So that's the 60 to 67%. For woman, it will be half of her weight. It's actually fluid. Okay. When we look down here, we have here the water, the H2O. So the water go inside, okay? And we have here the H2O and H2O like equal from inside to outside. When I'm talking about inside and outside, that's inside and outside the cells. And we have on the very down one, we have the water go outside from the cells, which is, I make it the other one here down there. You have this one, the H2O, it's going outside the cells. And we have here from inside and outside, they equal. And the third one, the water go inside the cells. What does it mean? You remember when I talk about hypo and hyper and ISO?
Yeah.
Okay. So if we go to slide 4,
Okay.
when it's ready, just tell me, because
Yeah, it's ready,
the
Dr. Ray.
screen.
Yeah, it's ready.
Okay.
I,
So When I talk about hypertonic, that's the water come outside from the cells. We call it hypertonic. Isotonic, when the inside and outside is similar. And you can see how it's good now, like it's in a good shape. We have hypertonic, when the water or the fluid go inside the cells. Okay, so what happened here? When the water go inside the cells, what will happen? The cells will be swollen and burst. Yeah, like when you blew the balloon. So when the water or the fluid go inside the cells will be swollen. We call edema. So when the water leave the cells and come outside, okay, that's another thing. So when we deal with the solution here, for someone hypo or hypertonic, when we use the solution in the hospital, we use the hypotonic. When someone hypotonic, we use the hypertonic. You got it?
Okay.
Hello?
Yeah.
We're following.
Yeah, because I feel like
Oh,
okay,
yeah.
so when
Wait,
I have patient with hypertonic, I use the solution hypotonic. When I have the patient come with hypotonic, I use hypertonic. Okay, so it depends about what we need to know. If the water move outside from the cells, which is it's hypertonic, okay, because the fluid always love to go to hyper. So when the water or the fluid come outside from the cells, that's hypertonic. So I will use here the solution hypotonic. If the water or the fluid go inside the cells, now I will use the solution hypertonic.
Hypertonic.
If we go to page
hypo
5,
and hyper. So that's a difference, huh?
hypo, it's less or under. Hypo. Hyper, it's mean more or over, more than and over than. Yeah. Iso, it's mean equal.
Okay.
We go to page 5. You see page 5?
Yes, we see page 5.
When it's ready, tell me, because I
It's
can't see.
ready, Dr.
We're
Ray.
good.
Yeah, we good.
Okay, so in page 5 here, I put example for what will happen. So
No, you're good.
you got it? Okay. So we have here isotonic. So that what?
Equal.
Hello?
Isotonic.
It's equal.
What do you
You
mean?
hear me?
We can hear you, Dr. Ray.
You hear me or not?
Yes, we can
I
hear
hear
you.
you. I hear you good.
Okay. So you are in page 5 now?
Yes,
Yeah.
I'm in page 5.
Okay, so page 5 here, we have the isotonic, which is the osmotic pressure outside the cells is equal or same pressure inside the cells. So this is the perfect one. When I have the fluid inside the cells, similar than outside the cells. And then we have the hypotonic. We have here the solution. You remember when I said hypo, the hypotonic, which is mean the water move into the cells. When we have the hyper, the water will move out of the
The
cells.
cell.
Okay. Get it clear?
Yeah.
Or not really?
I have a question, Dr. Ray, for that one.
Yeah.
My question is, so is the cell supposed to have water, and how much water is supposed to be in the cell?
Okay, that's a good one. Can we go back to our screen?
Okay.
Okay, this is a good question here. When we do the blood test for any patient, the blood test, when it's come, it will show us what we need to do. But again, it's about your age, about your weight. You remember where, like, for example, we have the blood. The blood is 5 liters. We have the water, okay? The water for man adult or for adult man, it's around 3.7 liter. For woman, it's around 2.5 liter. So if you calculate the blood 5 liters plus the water for woman, that's 2.5, for man 3.7, and then you calculate his weight, and from the calculate the weight you can get like around 60% fluid. But from the blood test we will understand. Okay, for example, diarrhea. Okay, diarrhea, the patient, if someone have diarrhea, he's losing water, like losing fluid, or the cells keep fluid?
I think it's losing fluid. Huh?
Perfect.
Is it?
And when losing fluid, this is hypertonic or hypotonic or isotonic?
I think it's hypo because it's less. Is that right?
Or isotonic?
No.
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 Okay. Remember, if hyper, when the water
okay.
leaves
Yes.
the cells outside.
Yes.
Hyper.
So if someone have swollen body or swollen food, that's
Yes.
mean the water moved inside the cells.
Yeah.
That's why you get swollen food.
Swollen. Yeah.
If someone have diarrhea, that's mean the fluid move out.
Out.
Out. Okay.
Not
So
move
it's
in.
That's
hypo.
hypertonic.
Okay. So for example here, when someone have diarrhea
Mhm.
and he's away from the hospital, or in Sunday or Saturday, and you need to do as your mom or to your husband, to your kids, or to yourself as emergency. When you get diarrhea, what you will do? Remember, we said diarrhea, it's hyper, when the water start to move outside the cells.
Okay.
Okay, so we need to do here, like in English, we call kill 2 birds by one stone.
Stone.
So we need here to do the dehydrate or the rehydrate, which is we do the hypotonic oral. Okay, how you make the hypo to treat the hyper? This we call it home remedy, or emergency. You can do it for yourself, and it's an easy one. You have pen and paper to write after me?
Yes, I
Yeah.
do.
Okay, so 6 teaspoons of sugar.
Okay.
Okay, ono.
Oh no.
Then half teaspoon of salt. We call it half level. Like you can get, if you have the level, you can get 6 level of sugar. You can get half level of salt, or which is half teaspoon of salt. And then you get 1 liter of water. You boil the water, and after you boil the water, put the salt and sugar, mix it, cover it, let it cool down, and after you boil it, let it cool down, and then you will have 5 cups or 5 mug, because the mug is 200 ml. And these 5 mugs here, you can drink 1 mug each 1 hour. Okay, which is the end of the day, you will drink 1 liter in 5 hours. Okay, and that will stop the diarrhea. Why it will stop the diarrhea? Because we use here something called hypotonic to
Hypotonic.
keep the water inside the cells, to keep the fluid to move inside the cells, not move out. And this we call it home remedy or like first aid for diarrhea. So if someone have diarrhea, if you don't want to buy medication or anything, you just do this solution. And if it's not to stop within 5 hours, now you can go and take medication. But this, we call it like emergency home remedy. And this is oral. So no one give it to himself in intravenous, because we have hypertonic, we have hypotonic, we have isotonic as oral. And we have hypotonic, isotonic, we have hypertonic as intravenous, we call IV. So for this one here, for diarrhea, okay, this is, we call it like home remedy, or you can do it in yourself if you get diarrhea. If any of your kids, your grandkids, your husband, your mom, your dad, you can do it like this. It's home remedy. So we use here, we make hypotonic to do the hypertonic. Okay? Another home remedy here. If someone with hypotonic, especially swollen foot, like if he have swollen in his leg or an ankle, how we do it? Our parents, our grandparents, our generation, they get warm water and they put Masima. The Masima is sodium chloride. So what happened when the salt solution outside your foot, so the fluid will move from inside the cells to outside the cells, and that's will reduce the swelling in your foot.
That's isotonic there. Yeah.
What? No.
How much the water, the warm water?
Okay. The warm water here, it's above your temperature.
Above
your
the,
body
okay.
temperature. And when we put the Masima, so the Masima, which is will make, you remember when I said the fluid like the hyper to go to the hyper. So we create a hyper solution to soak your foot, and then for the hyper solution, the fluid, it will reduce the swelling in your foot, because now the water or the fluid not inside the cells, it will move out.
Out.
For example, when the doctor prescribed Lasix for people, they have like fluid in their body, they can't do urine, have problem in the urine, and they start to get more fluid in the body. And we need to take the fluid out. So the doctor gave Lasix. So the Lasix here, it's actually what? Hypotonic or hypertonic?
Hyper.
Perfect. See? Good.
Why are you looking
You
at
get it,
me like?
Yeah, he's good. He's good.
Yeah.
Emmeline, you get it or not yet?
Oh no, I'm getting it. I'm
Brenda, you
sorry.
get
I'm
it?
just
I got it, because he looked at me like hyper.
It's clear, Emmeline, or not yet?
Oh no, I'm there, Dr. Ray. I'm there. So
Okay. So we the doctor deal in our body to how to manage the solution or the concentration of the fluid or the pressure of the fluid inside and outside the cells. That's the main theory. When we have, when someone go to the hospital, we do the fluid. For example, the sodium chloride, okay? We have different concentration in sodium chloride. So the proper one, and you will see in any hospital anywhere, the 0.9%. Okay.
Dr. Ray, before we go there, I have a question for the swollen foot, because I'm using this one here. Can you see it? The Epsom salt.
That's perfect. That's
the one that I got from the always use on the warm water when I have a, foot
Dr. Teals.
Yeah,
I tell you what,
had, that's what
even
I
if you
use all
have,
the time. That's why I want to show you, Dr. Ray, on that one.
this is perfect. Even if you have muscle spasm, okay, this type of salt, just put it in your
1 cup.
bathroom and have a
Yeah.
bath, soak
Good.
yourself, and that's what release. But why, like if someone have muscles cramp, what is muscles cramp? The fluid in or out?
In.
In, perfect.
Oh,
Okay,
what's the
so
time
we
of
use,
Lifey?
yeah,
Lifey got it.
he is
So
very smart. Because if you remember, the muscles cramp, it's a cramp inside. So the fluid here, it's not equally, or the pressure
right.
inside the muscles is not as out. So that's mean the fluid is in. So we need to do out. So when you soak your body in Epsom salt, which is magnesium salt, which is actually magnesium chloride, okay? So what will happen? We create another solution, which hyper, and this will relax you. Okay, so everything how we make equilibrium from the pressure inside and outside the cells, and from the fluid inside and outside the cells. You know, for example, our cells, we have in our body 3 trillion cells, a lot of amount of cells. Between each cells, there is a fluid. In blood, we have fluid. Okay, that's why when I said people drink Inovai, drink water. It's not about in people, they laugh at me, you know, it's not about laughing. It's how you make the equilibrium between inside to outside. Okay, like for example, the nitrogen solution, the intravenous, the IV nitrogen. Usually, first of all, it's so expensive one, but we give it to the people, especially after surgery, because they will not eat if the doctor don't want them to eat, because this will keep the amount of the protein inside the plasma, they will not lose the protein. But this, when I don't want someone to eat, when I stop him to eat, okay, so what happened after that? Maybe I want to do an x-ray or CT scan, or I take him to the surgery. But when I give nitrogen for someone have gout, that's definitely will bring the gout back, the gout attack, because I use nitrogen solution. Okay, but again about the percentage, because for example, the sodium chloride 0.9%, that's isotonic. When the doctor here want to keep the blood or the fluid in and out, the cells psi B equal to each other. Okay. Sometimes we use the sodium chloride for diarrhea. That's why it's very common in the hospital to use the sodium chloride, NaCl. Okay, because it will save the doctor from the headache, or for more calculation. As much I keep the fluid in and out from the cells, I'm safe. That's why it's very popular, and it's very common to anyone in the emergency to have the sodium chloride. Okay, we can use it for kidney failure, because the percentage 0.9%, this is isotonic, but we have the 45%. Okay, 0.45. The 45%, we use it for severe kidney failure. Okay, and we call it, we have the WD5. So it depends about what the doctor want to do with the patient. But the easy way to save the doctor headache, just give sodium chloride. That will make the solution equal. But sometimes I don't need it to be equal. I need to have something straight away. And after I use, for example, the guideline when you use the hypotonic fluid must be followed by isotonic. And when you use the hypertonic, must be followed by isotonic. But most of the doctors, they just give the fluid isotonic to give themselves headache. We have glucose fluid, and this we use it for hypoglycemic. When someone fainted, like with low sugar blood, we use glucose to keep him up. And after we use the glucose, okay, we use the isotonic. So the guideline, after you use this one, use isotonic. Okay.
I have a question,
Isotonic.
Dr. Ray.
You,
My question, Dr. Ray, because my husband history of gout, why would the doctor be using a nitrogen solution? Is there any other alternative that he could use instead? Because what happened, when he gave him that one, it just flare up his gout. Maybe he did not know that my husband have a history of gout. But is there any other solution to that?
look, I tell you what, with your husband, because the doctor was focused on his kidney problem.
Okay.
So that's why he used the nitrogen.
Okay.
Okay.
And 0.9 was safe.
No, he stopped the nitrogen and he gave the sodium.
Okay.
You know, after he gave the nitrogen, he started to stop the nitrogen, which is, I'm happy that he stopped the nitrogen. And then he follows isotonic.
Okay.
No, the guideline, what you use, you have to follow is isotonic at the end.
Okay.
So he stopped the nitrogen and he gave him isotonic.
Okay.
Which is sodium chloride.
Right, right.
Because whatever you use, you have to use isotonic.
Okay. But with the gout patient, so that will be a less priority for him. So his focus was on the kidney first, is that right?
He focused in the kidney, and I think that's, you know, the end of the day, we work with priority.
Right.
Okay, I have kidney damage or gout. I can live with gout, but with kidney damage, I can't, you know? But I think what happened, when he gave the nitrogen, which is after that, he found he have gout and the problem is not belong to his kidney. So his decision to stop the nitrogen.
Okay.
He thought it's kidney damage or something on the kidney, and he straight away as priority, he gave the nitrogen. And then after a while, when he found it's not belong to the kidney, he stopped the nitrogen and he followed the guideline to give isotonic.
Okay.
You got it? But at the end of the day, that's caused severe gout attack.
Yes. That's what
and
happened
when
to him.
you remember when I said he need to drink more water?
Right.
Why more water? Because the uric acid is soluble in water.
Soluble, right.
And at the end of the day, I want to make the water go inside the cells.
Okay.
Otherwise, the cells will be shrink. That's will get the attack.
Okay.
You know, the end of the day, we work with chemistry. I need to have like isotonic, hypotonic, or hypertonic. These three important terminology in the whole medicine world. I'm telling you, any disease, any medication, like, you know, for example, we have the RL around, like, it depends about the concentration. We use RL for nerve damage or nerve disease or nerve attack like MS. After that, we following by isotonic. But again, there is other percentage in RL. This is isotonic. The end of the day, when you look to the bucket, you will see if it's isotonic, hypotonic, or hypertonic. And when you see the bag there, you will understand what the doctor wants from you or from your family or from the patient. If he uses isotonic, that means he wants to keep the equilibrium, the fluid between inside and outside, and the pressure between inside and outside. Okay? Most of the doctor or the majority of the doctor, they want to be safe. So they just give isotonic. They try to throw the pressure to the other doctor or to the other specialist. And maybe the other specialist will continue isotonic, or he will take decision, no, I will use hypotonic for maybe 5 hours, and then I will go to isotonic. Like if I have someone with severe edema, all his body swollen, there is no way I will give him isotonic. No way. I need to give him something to move the fluid out, which is I need to give him a solution. This solution, it will be hyper.
Hyper.
Not to make the fluid go in.
Yeah, okay. Hyper.
Okay. So when I have someone with swollen, like, you know, okay, if I have this patient come with fluid in his lung, okay, I will drain the fluid, but in the meantime, what I want to do, I want to make the cells take the water out. Otherwise, what will happen after I drain the fluid, it will come back again. And every time the patient will go to drain fluid, to drain fluid. You know, it's not about this, what I want to know. When someone comes with like lung fluid, yes, we drain the fluid from the lung, but in the meantime, I will tell the patient, stop for anything can make the cells take the fluid in. I want you to have something to make the fluid out. You got it?
And what would be that one, Dr. Ray?
To make the
Take
water
the fluid
move
out, right?
Okay. For example, the type of the food,
Okay.
If I have more salt in my food, what happened? The salt will keep the water. So definitely zero salt.
Zero
Okay.
salt.
Zero salt. Because if I have salt, the fluid will be held in my body.
Yeah.
Okay.
Okay? We have potassium. Potassium, it's a salt too as well. So that's mean banana, potatoes, sweet potatoes, they have this type of potassium, which is I will not go through, okay? Especially the potassium. For someone have pneumonia or asthma or common cold or flu or have kidney problem, I will keep him away from any type of potassium. Got it?
Got it.
Because I need to make the cells out. But what happened when I told Brenda that your husband doing good when he gave you the mango and the strawberries? Why I said that? Because here the mango actually it's isotonic and the strawberry it's isotonic. One salt, one sugar. Like the mango is salty, but with sugar. Okay. And what will happen when you have the isotonic when you have cold and flu? So that's will make the pressure stable in the cells. So when you get cold and flu, you will not lose fluid, because usually when people get common cold and flu, they will have diarrhea.
Okay.
Yep. So what will happen now when she have the mango one that's isotonic? When someone have orange or lemon, that's isotonic.
That's interesting.
So we need to keep this fluid inside the cell. So when you get fever, that's mean we need the fluid to be in, not out.
Out.
That's why when you get fever, we ask you to drink more fluid, drink more water. Why? because the cells will have enough water to or fluid to survive with the heat. Because if you have a kettle and you put it in the stove, from the heat it will be steam, then the water will be finished. Yeah.
Yes.
So we need, when someone get fever, to drink more water, and that will keep the fluid run. To have isotonic like mango, lemon, orange.
Dr. Ray, when my
Strawberry.
kids have fever, I give them the ice blocks, like the popsicle. Did you hear that, Dr. Ray?
No, look, I have to look out and come back again because the sound is gone. I will look me again, okay?
We hear you pretty
We can
good.
hear you, okay, Dr. Ray? Oh, he's coming back. Còn mẹ có nêu tao nó có cái Dr. Ray life here.
Ai mà nghe cái tàu mà hay nữa.
Pada tao nói cái time ko te alak farmaki pahanga ko he farmaki o mai ko ka kita ko IV.
IV.
I ko experience ko na uyay ko he weekend ni ko mahawa. Ay ko IV ko ni na o mai na to nitrogen per mo sodium. Ka ko ne pe ya ko opu mune hanga formatala ko ni ke mahina ka tao tol ka ta wal farmaki ta ilang me ko mai ton ke mai ka tao to me ko ka ke o mai So that's what he's talking about, you know, those IV fluid that the doctor is giving us at the hospital. So, and I thank you, Dr. Ray, for giving us let's say a one-on-one of this one here, because you really open our eyes to a lot of things that we're exposed to here in America, but we have no clue what we're into.
We never ask question right at that moment, you know, because we want to feel better.
You want the surprise?
Yes.
I talked to the doctor there in America, and I've been questioning him. I need to do this blood test. I want to do further investigation. Okay. And you know what? He responded to me, and he said, our system in the hospital in America to make the patient stable, like isotonic,
just stable,
right?
If he's breathing and eating and go to the toilet with no issue, we release him and he will follow up with his family doctor. Otherwise, we'll not have enough beds in the hospital. So our main thing in the hospital is to make the patient eat and breathe and go to the toilet. And I said, that's it. And he said, yes. Then I said, put me back to Brenda, to Emelini. And I tell you, I surprised for this type of this. I wonder why the American people complain about the medical system. It's very poor in America.
It's expensive, but poor.
Yeah, you know, I think what he was saying, because of the pandemic right now, because they're quickly
No.
It was not the pandemic, right?
Let me put it so clear. Here in Tonga, I believe we don't have the same facilities like America.
Right.
Yeah. But the doctor tried to do hard according to what they have. Okay.
Right.
In America, they have more facilities and just the system to make the patient eat, go to the toilet and breathe, and then he follow up with the family doctor and for further investigation.
Dr. Ray, that's my...
And even I asked him why you gave him this solution. And I asked him, he have 1, 2, 3. And when I talked to him, he's been like looking to Emelini and look back to me. And it doesn't make sense to me. Even I wrote notes.
Yeah.
But at the end of the day, people here in Tonga, they complain. And people in America, they complain. You know?
Yeah.
Yeah. You know what, Dr. Ray, what I felt like in America, we take a lot of things for granted. America have the best, let's say, the health care, But at the same time, we kind of in a situation that we kind of more trusting the doctor, but at the same time, that trust, the doctor don't really look for our benefit or the best from us. What the doctor is, we're just a number to them. The way I look at it, because like he said, all he does is to make sure things are stabilized, and then he'll let you go, and you're gonna go deal with your primary doctor. But at the same time, we have the most expensive healthcare system in any country, you know?
I don't agree with that, because I've had this one doctor with all my kids, and he's from Vienna, and I'm just questioning the fact that Dr. Ray is from Egypt, and this doctor I trusted so much is from Vienna. Well, what happened to our American doctors?
Dr. Ray,
Yeah.
I think is the money. That's
Yes,
what we're doing.
I believe that too is the money. That's what I'm trying to say.
Oh my God.
They are good physicians here in the United States, but the money they want
Yes,
to your doctor, because they give you the run around all the time, and it's not a good thing, but the people just go because that's what they are told. But listening to this kind of information is very sad.
It's sad, but that's reality, because we're spoiled to have Dr. Ray.
I remember I told him when I just like I respect he is from where he come from. The end of the day, he follows system. But I asked him, why you give this medicine for someone have this disease and this disease and this disease? And he responded to me, the blood pressure, and he looked at the computer. The blood test is normal. I said, yes, the blood test is normal. What about this one? What about this one? What about this one? If it's normal, that's mean there is miracle happen. And he just like looked at Melanie and looked back to me, like, because this type of medication, we can't give it to this certain type of disease. It doesn't matter if the other blood normal or not. And then where's the guideline?
Yeah.
And after I finished, I called Melina. I told her I think that the doctor get angry with me, but she told me the doctor said, with all my respect to Dr. Ray, he have his view as a neurologist, but we have here our view. We want to make the patient stable, like isotonic, and then we send him home and he discharge him to follow up with,
Lene, it's about time Lene will change her major.
no, but we're blessed. I tell you, we're blessed because of
We
Dr.
are
Ray.
very blessed.
We're very blessed.
And it's a
because-
shame, though. It's
Yeah.
a shame,
It is.
though.
It is a shame, you know.
It,
But the good thing about this one, Brenda and Lively, when we get educated, what Dr. Ray is doing right now is educating us on what we need to look for when we go to see the doctor. You know, I don't want to
awareness.
just, yes, the awareness, exactly.
Malpractice.
it's
Yes.
very true. It's very true. It's very true.
Mm. And
We
I
will
tell
have
you,
a
that's
great
what
day.
happened to my husband. The gout was so flare up, you know, because they were giving. And I'm glad that I was talking to Dr. Ray because of, you know, otherwise, because we couldn't figure out why he having so much, the gout was just addicting, you know, so badly. But I understand because of what they gave him, you know.
Yeah.
So,
yeah.
Dr. Ray, my
Yeah.
doctor diagnosed me, and I have gout, I have arthritis, I have high blood pressure, and I so many things. And I said to him, why the hell I have all this and I still live? There is something going on here that and sometimes I think they give you the worst of it up front, so you can afraid, so you can create this feeling that you're afraid of everything.
Oh my gosh, Lifey, you're making me scared.
Listen to this, Dr. Ray. And then he just told me, he told me about 6 years ago, I see something in your kidney. And you know, just last month, he told me, he referred me to the kidney doctor. And I went to the kidney doctor, and the kidney doctor, she said, you're already go dialysis. I said, the hell? I'm not going to dialysis because it's right. And I'm not going
what you need, life is a food circulation.
I told him, I'm not going to my doctor anymore. The doctor, regular doctor, I tell him, you are off my list. I don't like you because you don't tell me this kind of stuff.
I tell you, so he been with you all these years.
Yes.
And then suddenly he surprised you with the kidney. Oh my gosh.
That's what I feel. I feel so that's why I feel so misleading. And I know.
Now you can move the Dr. Ray and just do food circulation.
That's the only reason why he comes to our show.
No. Dr. Ray, I can just use this free method that you have here. Hypo, ISO. I will be just fine. Instead of going to the doctor and he tell me all this crap that I don't need to listen to.
You know, our body work with chemistry. Like
Yeah.
in chemistry, we have the chemistry, we have bio, and even when I explain the gout and what is the gout, where it comes from, and what is the uric acid and how we can solve the uric acid, I explain everything in chemistry. And even now, when we talk about isotonic and hypertonic and hypertonic, hyper. So hypo, hyper, and iso.
I can just live with that, Dr. Ray, and I will be just fine. Come to the doctor and they tell me,
Really?
I need to listen to.
Okay.
Right.
What about we have a break and we play the ukulele? What you call it?
Yeah,
Ukulele?
maybe, yes, let's do a ukulele break.
Yeah, and that will take the arthritis and the gout from your hand.
Yes,
Oh, good.
Lifey will cut a ukulele break.
Yeah.
You want to do that, Lifey?
Yeah. Because
Is
I
the
laugh
ukulele
too
right
much
next
and
to
my
you?
face is hurting.
If you play it well, that means you don't have arthritis. Don't worry.
Okay. No, I'm saying I laugh too much and my face is hurting.
Okay, we'll give Lifey a...
Dr. Ray,
Yeah, get the, what you call it again? Ukulele?
yeah.
Ukulele. Ukulele.
Ofulahi mahakia ulau elaiphone masi.
Yeah.
Many hundreds of I will think of
I always
everything.
tell him, what else do I have? I don't know.
Play the ukulele and then Dr. Ray will tell which one you have.
Okay. All right.
Okay, yeah.
Okay.
Dr. Ray?
No, you come right now.
I'm listening. So mute the mic so I can listen.
Okay. Okay.
Dr. Ray, this is for tonight information. It's so good.
Okay, play, listen.
What do you want to play? You want me to play a song?
Yeah, of course. My God.
Like you will cook with the ukulele. Of course, I want you to play song.
Woohoo! And do the hula.
I am but I was strong.
Oh, wow.
Jesus, give me from all wrong. I'll be saved this as I walk.
Let me walk
close to
thee.
when this life is frail and true. See, just keep me from all wrong. I'll be satisfied as long as I walk, dear Lord, close to thee.
Wow. Very nice.
Wait for it.
More. One more.
Very nice.
More. One more.
Brendan, can you give me just 10 minutes? I have patient come. And I
Yeah.
come
Yes,
back.
that's fine, Dr. Ray.
Yeah, that's okay. Yeah, you're good.
I have patient come.
Yes, that's fine.
Okay.
You need another one?
Yes. Remember that song we play is 3 minutes. You're only playing 3 seconds.
Give me some song. Just give me some song to sing.
Kahapon hiwa ko na, gahiwa ko pa manato. Sing that song, Lifey. Brenda, make sure
Yeah.
you don't.
Okay.
Hiwa ko fast ko kay manato, Brenda.
Così si è occupata. Poi Ivana ka vai malo si sie. E time na na kupenga ito.
Yes, it's only come to be. I feel
All right.
to come to me. But it's only come to be. Yes, it's only come to be. I feel
See what?
Marie!
Hi, Angie.
I know that you want me no more. How I need you, how baby blue.
All right.
I forgot.
Ada voi fratonga.
Foi Fatonga? Já foi Riva.
Si fisse lo se.
I don't know that one.
Outside. Tá Maria, sai life family mori. Maria pito ta man, we'll find some more music at keke. Ako ke time those jingle.
That was so beautiful, Lifey. Tao breaki ho ko pe kai ma pe fo hiwa fa ta pa te tam ha ko Dr. Ray ko lo to nga I ene client tai ni mi pa to ki ha ka ko kulau o ko mau inga au pita. I think you get this thing, Lifey, the isotonic pe mo hyper pe mo hypo ka ko
And Emeline, it's very important because it's for
Without
ourselves.
yes.
health is made up of cells all over the place. And we need to know how our cells respond to our body and to
Right,
things.
right. You know, cái mấy cái này mà cái cái điều係會嘅呢，小個嘅方向下個份嘛嘅，個那 prioritize 那多啲I situation嘅， but then my husband have work out yeah 咩個呢，我個呢好過嘅but they suspect is the kidney, and then turn out to be I think what Dr. Ray. The good thing when what he did, I see again history, all the medical history of back to the 2010. So it gives him an idea of what really happening to him. So now I suspect that there's some kind of infection in the stomach more than what the doctor here think, I have a I'm get the ilo ekita, Kita ilo kita tunga ko kaya peko to loved ones, peko hata to family, te alwik farmaki. Ang toton pa kita ilo kaya may ako ni, Heko nga ite na ufay na tole na ufay nga fakau. But at the same time, when you challenge what they it's okay to challenge it, Heko nga heko te ilo kita. There could be anything that one might, hokoha now and then gonna end up in the wrong side, You know what I'm saying? I have a but I tell you, for me, I felt so much blessed to have Dr. Ray because the weekend I consult with him, and then he challenged
The whole time,
the whole time I was. Yes, the whole time I was.
That was important.
And with my husband in Farmaki, I consult with Dr. Ray, so.
Okay, ilo lini.
Oh yeah.
Ki eta tu pe I. Momentu ko time ko ave ato ita to ke ER. O ko ke na lama na tolo fai ha real immediate keyword kia kita.
Sure, of course.
Ko prognosis pe ko ta hua tu ko hamen e hoko bena ke to bena ke whatever. But now the base bit now to ria ke kau ER people go ka uri. Mantu yung now, now communicate kapag emergency. Kako mo ni ia apita ni tala noa he kono uinga na mantu ko na kon ko he oyster.
Right, oyster, right.
Awe na me also singa bia ia kapau na kai ke vave mai e kutoke ta personal doctor ke farmaki. Na u request ia e au kono ngā koe situation koe na aku iai. He ku tala mai pia kai ke ia haku white cell koe ia aku or something. So,
Kanane mana tu na netalat kako prenda na save ko he kapasota ko na ke
Yes.
He said you drank some soda, so.
He koe rini. Koe o se foi ahau ia tolu. O kai ke ongo e au hamia. Hala wharere. Pake ela ku mamai ko he hala ko tātau ka awha. Awa ke tū ke o mai ange paka fu big gulping of Coke.
Right.
Pea ko paka ku mauwhi apita ki up. So just about 5 minutes ku mau ki api. Ka ke taimga na ui noe fu big gulp. Na kai ke toi pause. Inu I pia osi toi o mai mu wipu vai toi o mai. It just the soda went in first.
So crying for fluid,
Iyo. Pako mahalo mona apita Dr. Ray. Na wala toi ne whai huhu. Ne whai huhu toto ki au right away ia ne alerte familia ke na mau huhu toto because I was already on the verge.
What is Dr. Ray is trying to tell us is very helpful. We don't
Awareness.
Yes, there's awareness. Fine.
We don't really go to the doctor for anything because we can always get the the information, and then we just follow it. We don't have to listen to everything that they say. You know, like,
everything is about money, you know.
yes,
You know, which is a number, eh? Kag mau inga peke tau ilo, e tau tolu ai situation, eh?
Oku whainga tā ia au pito e kau toke tā, especially now, eh? Kono inga he koe liability too, eh? O now very, very picky now tōru ia. Ke kakai ko o si ai pe existing
yes,
mahakia now tōru, ia, condition, eh? Ka koe ko reality ia. Ka mantuinga tau i tō ngata tōria na free e tau medical a tau tōru ia,
yes.
you know?
Yeah, it's a free medical, but it's not like the top of the line, eh?
Yes.
But take a you know what I'm saying? But you know what? I tell you,
They were good.
But they were so good. Because I know my mother, going off on the first cousin of mine is not well
Attentive.
yeah, attentive of it, yeah, I thought that. Kago at the same time, nang I may hang go back on the local a Dr. Rico and some kind of home remedy was given, eh? But I be if I go him of fire, my dolu. May I home remedy pen I want to be a mangisiki more.
And that worked, babe.
It works, it worked okay, eh? It worked okay, so. Kagaila go ilogo out time home remedy because our body is so toxin with so many medication go out take eh. I love home remedy. I go out quite big. So man, one of the things that contribute to my health, I'm 56 now. Quite medication. I don't take any medication at all. Eh? Very conscious where anything I put into my body, and I'm always like go with the what do you call it? Natural herb, right?
Yes.
You know, and I get this from my mother when I grew up. But for me, I would love to encourage a natural medicine. But you know, Brenda, we have natural medicine here, Americani. But quite recognize for now, because
Recognize now,
recognize that for pharmaceutical, eh? But you know what? They know the weird part.
India kula.
Oh no! I'm talking about the natural.
Oh yeah, natural herbs. Yeah.
But you know what really, let's say, I'm not sure what word I'm trying to say here. Kadai go hospice go client I patient ni. Katak time na seni kakai natural doctor. Heko mana do ilelay good Sam go henny away pay I building here that fun pick our natural doctor yeah. Recognize now though don't you refer pen out a client go to pay was the hospital don't have anything else to give them, eh? You know, but that's when they start recognizing them. But I'm hoping one day that they will really recognize these people and give the people a choice. Choice peko yeah peko get a natural doctor peko get you know. But I know for sure why we don't have that choice or I can recognize now because of everything is run by the pharmaceutical, you know, because of all the medications and you know
and because of money, they want their money.
Exactly, it's all about money, you know, money talks, you know. But I'm hoping back at our healthcare one day it will give us that option that natural medicine is part of your choice. You know what I'm saying? So,
that should help.
I'm still watching for Dr. Ray to come back in. Kaku, lotong ay tao tayo ka Dr. Ray ke foki mai. Okay, to bit we'll have another 34 minutes. Life in Jaha for Hiva for Tonga ke umay pega tao.
Tau fohiva rini, tau fohiva jingle ka of going to get that. And fohiva great culture.
Oh yeah, okay.
Oh, yeah, those are beautiful. Life
Okay.
ko ma jingle and go nga hiva ni time ko no ai tonga.
Let me see. I think give me a minute to go in here, Brenda. So you guys go ahead and talk while I'm trying to get back to that.
Pe ha life ko o ke ilo api ko vai malo. Life. Ko api ko ane life, are you listening? Oh, unmute my telephone niya. Okay. Where's it?
Now I can, do you hear me?
Io. I remember my mom was talking about the funga muilele ui vai malo.
Yes.
Na e kakala pe me kakala whai to'o mui ngahi. Mui ngahi akau ki he whai to'o. Pake mantu o to iai whoke motu
Oi.
next door. O kai motu I loto o kai koe malaki.
Oh yeah.
Eh?
Oh yeah.
O ku elini, o kai te akau ke he.
Dr. Ray's back in. Okay.
Yeah. Because shrubs ko to ako akau whai to'o. Yeah.
Okay. You're back here, Dr. Ray.
Hey, sorry, I just put the patient. I was consulting him, then I put him on the treatment, and I come to you guys.
Okay. What
Okay.
is color? Do you want to put back the PowerPoint, Dr. Ray, or you want to?
Oh yes, yes, yes. We
Okay.
go back to page. What page? Page.
I'm on
6.
page 5.
Yeah. So go to the next page.
Okay, let
We
me.
have the fluid like the sodium chloride. When I put some of the like isotonic, hypotonic. You found this one?
Yeah, but I
After
need to get back to you guys over here. So. Okay. Hold on. I must have closed my. For some reason,
no, it's okay. If you want, we can
Oh no,
continue.
I'm back. I'm back here. I just
There you go. We got, if you went to page 5, and the
okay.
page
Fine.
after page 5, that's where we are.
Okay.
You will see like number 10. I don't know how.
Okay. Do you guys see my screen or no?
I do.
have-
Yeah.
Yeah.
Okay. Good. Okay, we're on page 5, Dr. Ray.
Life, your image is gone.
Oh, let me,
Just turn on your video. Okay, but we're back onto.
So go to the page after page 5, you'll see like number 10.
There we go.
Accidentally.
Okay.
So you
I
will
got
have
it.
here, you will have here some sample of the fluid, the sodium chloride. That's NS. So that's isotonic, and we have the D5W. That's the 5%.
Give me a minute. I think my I need to share it again.
There you in your foot.
Okay, let me back here. Okay, now you guys should see better.
Oh yeah, very good.
So this, I just like put some type of fluid we can see in the hospital. Okay, so we have here sodium chloride, the 0.9% is isotonic, and we have the 0.45% sodium chloride, which is hypotonic. You got it?
Ah,
So sometimes you see some stuff that
45%.
the percentage, the different percentage can jump from isotonic to hypotonic. You got it?
Yeah.
So be aware from, it's not like sodium chloride all the way isotonic, because we have sodium chloride here hypotonic. It depends about what we need to do. But this is NS, the normal one in the hospital. We have NL. Okay. If you go back to, jump to page, the one after that, which name page 6, I give example here. If cell volume at equilibrium has increased, the solution is I said to be hypotonic or hypertonic. So here we talk about the volume, the equilibrium. What solution, if I want to do equilibrium volume, it will be hypotonic or hypertonic or isotonic. So for here, there is two things. If the cells, I want to decrease the solution, it will be hypotonic. But if the cell solution have equal concentration, okay, so the equilibrium there, it will not be net movement of the water. So the solution here will be isotonic, which is as the hospital normally do, and they put the isotonic, which is the Na, the sodium chloride, 0.9%. That's what I said, like when they try to be safe, not to be headed towards more calculation. Because if anything wrong happens with the calculation of the fluid, okay, that can cause severe or can cause death. You know, when someone play with the isotonic and hypotonic, okay, if it's not calculated in a right way, in a proper way, that can cause severe pain or can cause life-threatening. So most of the doctor in the hospital, they just want isotonic to save the headache. You got it?
Got it, Dr.
Okay, so we go to page 7. There is some important point you need to keep in mind when we do the tonicity. So what happening when we do the evaluation or the calculation of the fluid, or what I need for me or for myself or for my patient, there is some point it's very important to keep it in my mind. Okay, can Brenda read it, because I have to go back to my patient, but I'm listening to you guys when you read it. Okay, Brenda, can you read it?
The first paragraph?
Read
the
the whole thing,
second?
Brenda.
The whole thing?
Yeah,
Okay.
because Dr. Ray is going back to the patient. So
Okay, so important points to keep in mind about tonicity.
tonicity, right?
Yeah, so tonicity describes what has happened to cell volume of equilibrium, but does not tell you what happens to cell volume on the way to equilibrium. How do you say this right? Equilibrium. Equilibrium. We will return to this concept later. So it is important to be clear about the cell that is the frame of reference when discussing tonicity. Solutes, okay, so solidities that can enter One type of cell may not be able to enter a different type of cell. One example where this is true involves the this acrylide sucrose. That's the regular table sugar. Wow, it just have this. So mammalian cells do not have transporters to sucrose. So sucrose is a non-penetrating solute for mammals, but plant cells do have sucrose partners, making sucrose and penetrating solute for plants.
Okay, thank you for what does it mean? These 2 points, a very important point when we do the isotonic or hypertonic or hypertonic. Okay, number one, we are not changing the volume of the cells. We need to keep the volume of the cells equilibrium. What we need to do, because if you change the volume, if you change the volume of the cells, that's you will damage. So the main thing here, we not change the volume, we just change the pressure from inside the cells and outside the cells, and from the fluid inside and outside the cells. As I said, when we talk about the table of spoon of sugar, if you remember when I told you if someone have diarrhea, what you can do for home remedy, 6 tablespoons of sugar, half teaspoon of salt, and 1 liter of water, that can create the isotonic, and you give it to someone have diarrhea. Yep, and that will solve the problem. So we creating now isotonic. Okay, so that's why I said when we go to hypertonic or hypotonic for diarrhea, yes, we can create isotonic for diarrhea to be safe. But again, there is some specific from the doctor need to have decision. I need to give hypotonic and then I go to isotonic, or hypertonic and then I go to isotonic. When I have severe kidney damage, okay, and I don't have, like, I'm waiting list for dialysis, what I need to do, hypotonic or hypertonic, okay? And in fact, when someone have severe kidney damage or kidney failure, okay, the cells here, the water go into the cells, not outside, because the kidney can't filter the fluid. That's why the body start to be swollen when someone have kidney failure. So for this one, we need to create a solution to take the fluid outside from the kidney to outside, not from the kidney, from the cells in general. Okay. So when we talk about this, it's easy to calculate if you understand the hypo and hyper and isotonic.
I have a question, Dr. Ray.
Yeah.
My question, Dr. Ray, when my husband had that severe pain from the gout, how close that to be fatal if the doctor did not continue the solution that he provided on the weekend?
Okay, so for this doctor, when he used the nitrogen, he was I think his priority for the kidney. And when he found it's not belong to the kidney, he stopped the nitrogen. Because if he can continue, you know, if he's lucky, if he finished the whole bottle of the nitrogen solution, that will make the gout like second to none. Like, but what happened? I'm happy that he stopped the nitrogen and he go back as a guideline after the hypo. We gave straight away isotonic to make the equilibrium. Okay. In the meantime here, by giving the nitrogen and then he gave the isotonic, the patient need to drink water.
Right.
Because we don't change the volume. As I said, we change the pressure inside and outside. So when he gave the nitrogen, he wants to release the pressure for the kidney damage.
Right.
Okay. So and then he go back to isotonic to make it stable. Give me 1 minute and I will be back again.
Yeah.
Just
All right. Very
Okay, let me
important.
stop this. Go ahead, Lifey.
You go to page 5.
Sure. Let me put it back here. Okay, page 5, yeah. Go
I think that's 4,
one
you
more.
know?
No, go back
6.
right there.
Okay.
Yeah.
Yeah.
Is this the page you wanted?
Then you can just say what you want to see.
Do you want me to keep this on the screen or you want it off?
It's up to you. I already get it.
Oh, you got it? Okay. Okay, let me get it off so I can go ahead. Tôi có ai kia để mẹ có đồng để làm về cái kia hay quán có siêu cái kia. Các bạn này cái kia tôi yêu này cái consult một doctor ấy có tuyệt vời mà này ai phải kỳ mẹ cái tôn nó hiểu cái này. Hay có siêu cái kia ấy cái mẹ cái nào ăn cái nào tôi có cái nitrogen cái kia đó cái của này tôi hơi cao tí ở tôi lại học tôi ấy. But I was so lang apita kauti going up for I fluid kitu afogia pa ko of history kauti for many years.
Yes.
But attack kauti po ko ya baka lucky pen aw ya ge fai no vai yo lai and I know the awareness that Dr. Ray is giving us tonight is it just makes me more like open my eyes to like this because every time I knew that from Marcus over the loved one, because talking about go ahead. The ID, you know what I'm saying? But I think it's so important, you know, get out aware, get out active, you know?
Yes.
Ikaw nakakahangay ito tayo for history count I gonna pay gonna treat the kidney kidney kata kauti kago ilo ya gonna gonna love ko kaya Dr. Ray na behavior ko infection ya hekete aya gonna hope ko kaya and I'm lagi bangila buhay kami na hope. Also MRI but now let me see this they really didn't determine what was going on, you know. So I can almost see it was worse. Dr. Ray, it may be caused from a bacteria in the stomach, eh? Maybe take the probiotic kaya tao programa hay kavini ko nga programa ke tao awareness kaya vai because it's an educational platform and Tuesday night it's a night of awareness ke tao movie ke tao right.
You know,
nothing wrong with fehui.
Yes.
Friend, na ko kusisa na Fanemaki. But I want to go before she died, I went over there and she was swelling. I tell you, I was afraid of looking at her. It's like the skin is so transparent. You can see the water just running around. Her whole body was like that. She looks like a balloon, but just a form of a human being. She was swelling water. I was so, I didn't want to, I don't know what to say to the doctor, but we were just there to visit her and I saw the thing. I was so still in my mind to stay. And I was always asking why now I can understand from what he's saying. What is take out and what is, you know, how to.
How long before that you went and see her until she was gone?
She was in a critical. She was like about 3 more months before that, and she go through all this.
Oh, okay, yeah, okay, yeah.
And it was really bad.
Yeah.
You know, but when he's talking about that tonight, about this stuff, I know that what they do to get rid of those things.
Yeah, yeah.
Ako ay tayo ba tapos iba kimo ifokimat
Yeah.
Dr. Ray.
Yeah.
Okay, I think I'm ready with that one. I know.
And I will see you Friday 11. Very nice.
Ah, that was
Back to you,
beautiful.
Dr. Ray.
Sorry for that. That's a new patient. He have a foot drop. He lost control in his walking. He's been like this for 6 months, in and out from the hospital, being in all over the clinic here, and he have the same problem. So when I check on him was L5 and L4, L5S1. So I do, it took me half an hour, and he was happy when I asked him to walk. He can't imagine, he says like, wow. And even he's trying to try, he can't control his foot and walk. But I will see him again on Friday.
Wow,
When you know the problem where it come from and you diagnose it, and even he's surprised he's just walk, control his foot without medication. I said, yeah, just this is the first treatment. But I wrote to him some vitamins to get it, and I will see him again Friday.
Wow.
So I'm so
Easy
blessed
to
to have
fix.
you, Dr. Ray.
Okay. Who is here?
Yep.
Okay.
So I hear some what Lafini said about the doctor, and then you decide to play the song. What happened?
Oh, live on air. Go ahead and share with Dr. Ray what. Livey,
Yeah.
Dr. Ray wanted to hear what you shared earlier with your sister.
Oh, Dr. Ray, my sister was in the hospital and she passed. But while she was in a critical time, I went over, I went over to the hospital, and she was like floating in the water. Her body was, her skin was so transparent. You can see the water moving in her body. It was so scary. I've never seen anything like that in my life. And I said, how can that be? She just looked like a balloon of water. But, you know, her whole body is from foot to her neck. It's all water.
Yeah.
It was so scary. And but there was no doctor over there to talk to. We were just visiting, and I don't want to ask her what is going on because I don't want her to feel the pain. But she was there, and she cannot say anything. But we were just visiting. But it was so scary for me to see that much water in her body, and I don't know what the doctor did, but that's how she went through. And when she passed, I said to myself, well, I'd rather see her pass than to go through this kind of thing. It's really scary, and it's not necessary for her. But it was very.
You know, sometimes first of all, I'm sorry for your loss, for your sister. My condolences, and God bless her soul in peace. You know, sometimes the doctor need to have the gut to take decision.
Yeah.
Okay. Most of the doctor, they try be safe than be sorry.
Yeah.
I remember I have this patient in Egypt. We have injection for someone have a stroke or heart attack. We give the injection to release the stroke. Okay. But the problem here, the injection must be in the first 12 hours. Most of the patient, we are not sure if the stroke happened in 12 hours or after. What happened? If I give the injection and the stroke already past the 12 hours, there is a high risk of brain bleeding. Okay. So some doctors, even when they ask how this happened and when this happened, even if it's 6 hours or 7 hours, they don't put themselves in risk.
Yeah.
At the end of the day, patient get a stroke. So him and his luck. For me, I'm always have the gut, because you know what? Okay, in the Bible said, I'm sorry for, but that's the Bible said, a live dog better than dead lion. And that will show the importance of the life. So some doctors said, I will not take risk. The patient will be alive with a stroke, suffered. That's it. Rather to do something and the patient will die. Okay. Some doctors, they said, I will take the risk. But here, if something happened to the patient, you know, the doctor will be responsible for this soul in God. God will ask him about this soul. For me, you know, when I do the investigation, I ask a lot of questions. And then I told the people, look, you must give me a proper answer, because if I give the injection in first 12 hours, there is no any side effect of the stroke. The person will next day walk normal. I'm telling you, no one
guts.
can
You have to
tell
have guts.
that he had a stroke. No one can tell. But even it's after the 12 hours, we have 50%. If it's after 24 hours, forget about it. We never give it. So that's why the people, they try to give me more information. And you know, one patient, when I done the calculation, is just 12 hours. So now I have two options: give him and be ready for brain bleeding, or to leave him. You know what I did? I told the kids, okay, look, I will do it in this way. I prepared the surgery. So when when the bleeding happened, I will suck the blood straight away. Like, you know, it will take like 2 minutes, just put the injection and like suck the blood from the spinal cord, from the bleeding. And that will take the bleed off the brain. We do it in this way. Before we open, but now with this technology, we just like put the hoo-hoo in the spinal cord, release it. That's like 10, 12 years ago. So I took the decision. I will give him the injection. You guys pray, and I'm ready for emergency to be happened. That's my gut. Because I don't want this patient to be suffering. But again, I want him to be alive. I prepare, you know, before I give the injection, I prepare the surgery room. Okay? Because I have 50-50. And I give, after I prepare the surgery room, I give the order to prepare the surgery room. And I give him the injection. 20 minutes later, the stroke is disappear and he walk and talk and happy life. I'm telling you, some decision, the doctor must have the gut. For me, I will go straight away for your sister to take the fluid out of her body, straight away.
Yeah.
Which is, that will be the hypertonic, to take all the fluid out. And I will prepare myself. So see, look, some decision must have the gut. So what happened when I decide to take the fluid outside of the gut of the body? Okay, that can cause a heart attack. So first of all, when I try to do this one, I will put the ECG to monitor the heart. That's the main thing. That's my priority. Okay, and that will drain the fluid. And I keep my eye open on the ECG. I want to see the heart will be in front of my eye 24/7 when I'm doing the drain the fluid. It's not like I took decision, but some doctor, they like, what happened if she has heart attack? Look, in this situation, the person will die because already the fluid inside the cells, and that's caused damage to the cells. Okay, because what happened when it's swollen, boom. Yeah. So at the end of the day, the person will die. But some doctors said they will have the time to go. But for me, I have the gut. I will take decision to drain the fluid. In the meantime, I have to ask myself, what is the risk factor of drain the fluid from the body? I will have heart attack. I will have this. So I have to prepare myself for scenario will happen, and I will take decision to drain the fluid. That's why I said you must have the gut. You know, if you want to teach your son how to swim, what you will do, you have to throw them in the ocean. And you keep your eye watch on him. Let him fight. Sometimes the doctor needs to have the gut. Stand with your patient, let your patient fight. And you calculate the risk. And you try to manage the risk. You know, we study medicine to manage the risk. At the end of the day, everything under the sky has time. You got it? So
yeah,
sometimes emergency, you need the gut to have it. I remember one day this is happened front to, I wasn't the emergency, and I have the supervisor and I have the other doctor. So this person, we try to use the defibrillator, the shocking, to make the heart work again.
Yeah.
And I'm not cardiologist, okay, but we learn how we deal in the emergency situation. We deal in each part, so we have this type of knowledge, because sometimes you are there in the hospital by yourself, so what you will do. So we go to different department, different ward in the hospital, and I saw this patient there. There is no heartbeat, so they use the shocking 1, 2, 3, no heartbeat. Then the supervisor was there, and he asked the cardiologist, so what you will do now? And he said, that's it, I can't do anymore, otherwise the ribs will be broken. And then the supervisor asked him, get out of here. And he said, you know, I prefer for him to be alive with broken ribs rather to be die because you're scared of your decision. And he just tell him off. And he took it and bang, 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 you know, his heart is beat again. But what caused? Just like couple of ribs is broken, fractured. It's okay. He's in pain, but he's alive. He's alive. You know? So even sometimes people, they get shot, and we call it swallowing the tongue. They swallow their tongue, so they actually the tongue block the airway. For some reason you can't, there is a proper way to bring the tongue out, to bring the tongue back to the position. But in the same time, if you struggle how to put the tongue back, what you do, you have to open here. You have this, it will save life. Again, you have to have the gut to open here to make him breathe. Otherwise, he will die. So there is some situation you need to have the gut to take decision. I open here. That's okay. At least he's breathing. You got it?
Yes. Interesting.
Okay. Any?
So it's
Go
all
ahead,
about.
Dr. Ray. No, you go ahead, Dr. Ray. Sorry.
Yeah, I finished.
Okay. I guess our time is come to an end. Any final wording from you back, Dr. Ray? Because I know it's the weather is not nice to you there in Tonga. So
No,
Doctor-
actually, I'm going to other patient now on visit.
okay.
Okay.
We thank you, Malo Aupito, Dr.
Yeah.
Ray, and we thank you for your
Say hi
time.
to Sissy.
Say hi to Sissy, and always pleasure for us to have you back here on the show, and you know, raise awareness for all of us and our listener. We thank you so much. Saipe Meakotoa, back in
I
Tonga.
just want Brenda to call me after the show.
Yes, yes, Brenda.
I need a number. Just go messenger.
Yeah, call the messenger, Brenda.
Call me messenger.
Okay, I will.
Okay.
I will. Yeah.
All right.
Okay, we'll have Brenda call you.
Opat.
Malo Aupito
Brenda
Patu, Dr. Ray.
and me,
All right. Opatu. Yeah. Bye.
Maybe like Fana, you're gonna finish us with another ukulele if you have any. So,
I will do a karaoke.
okay,
Ew.
we'll do that. Brenda, have any further for Malo?
No, you're doing good. You're doing good. Now, behave the longo sipa.
Yeah, but look at you, excited and you know, looking good, and just talk to Dr. Ray after this to make sure
Yes.
you know you feel good.
Yeah.
So, and it was so nice for Angie to pop up and say hi. So tell him we say hello. Always welcome to TWN.
Kasi I go ke mante folk fa area Ari ki so lake all the time.
Ah,
Pai pa na activity na toloi sa ia ya Uncle Life.
yeah. Go ahead, Lifey, when you're ready.
Ano ato ke music, pero paano ke music?
Go ahead.
Yeah. Do you hear the music?
We can hear the music. Where do you play your music from? The phone?
Yeah. The old home, the old look the same. From the train.
Let's see.
That you meet me is my mama and papa. Down the road I look and there runs Mary. Hair cold and lips like cherries. It's good to touch that green grass of home.
Hallelujah.
Yes, they all come to meet me. I'm reaching, smiling sweetly. Oh, it's good to touch that green grass of home.
Kan lief hier.
The old house is still standing, though the paint is cracked and dried. And there's this old oak tree that I used to play on. Down the lane I walk with my sweet Mary. Health cold and lips like berries is good to touch that green grass of home. Then I awake and look around me at the four gray walls, and I realized, yes, I was dreaming.
Go back to kuate talaga. Ayaw.
At daybreaks, again. The green grass of
You just make me laugh, Brenda.
Now,
yes,
long back, ganito yung may lalaw.
in the shade of that old oak
Oh,
tree,
tree.
as lay beneath the green grass of home.
Woo!
Wow.
Grabe ka pongpong pag-check yung ngahi po live.
You did a good job, Lifey.
Thank you. That was so beautiful.
Lifey, but next time I'll have you be a co-host. That way you can play your music from your computer. But it was good. Well, thank you.
Very good.
Yeah, thank you.
Nasa na lol tang 5 May ni kay pinati.
Oh, okay, Brenda. Pagkakatanga daw siya kay Fefini.
Malo apito mumi amay mumi Paulia malo.
Come on.
mea. Good night.